Are you seeking a stable and rewarding career that lets you be part of the healthcare industry without the hands-on clinical work? Maybe you're looking for flexibility, or you like the behind-the-scenes aspects of medical work. And if you're nodding yes, that means that medical coding might be a good career for you. In this video, I'm going to explore how a career in medical coding might be the right solution to your problems, give you some of that work-life balance, that flexibility, steady income, and keep you engaged in the ever-evolving medical field. So find out how you can make all of those steps to get into this role, make some money, and possibly even make a difference. So you're interested in a career in medical coding. Maybe you heard that this is a job that has lots of remote positions available. Maybe you heard that there is good pay. Maybe you want to work in healthcare, but you don't want to work hands-on with patients. Whatever your reasons, I'm going to tell you all the details in this video. And today's video is sponsored by Preppy. More on them in a little bit. First, let's break down what is medical coding. So we hear medical billing and medical coding. They're kind of two different sides to the same coin. Medical coding is reading through all of the medical records and analyzing them and abstracting all of the different procedures, diagnoses, services, equipment, and then converting them into uniformed codes. The codes are used for a lot of different purposes, things like budgeting, analytics, patient tracking data, but we also use them to develop a claim form and use that to bill insurance. So the billing process works more with that end of it, getting things on the claim, making sure that they're aligned correctly, that they go out correctly, that they're paid on time. If they're not paid on time, you got to follow up on them. You got to work with the insurance company, usually on online portals, sometimes over the phone, but not usually with patients. Some of it is fairly straightforward. Something like maybe a flu shot might be fairly easy to code and bill for, but then we have things like complex surgeries and prior authorizations to deal with. So that's where it gets a little bit more complex. Now, there are certifications for medical billing. They're not as widely sought after in medical coding. Medical coding, you very, very rarely can find a position when you are not certified as a medical coder. There is no online program you can take that gets you certified. It's kind of like practical nursing. You can go to school to get a college diploma in practical nursing, but until you sit for your NCLEX and pass your LPN, you're not an LPN or a licensed practical nurse, and it's going to be very difficult to find a position without the LPN. Same thing with medical coding. And there's basically two main organizations that employers are going to look for, AAPC and AHIMA. AAPC used to stand for the American Academy of Professional Coders. You'll still see people use that. And they actually dropped that a few years ago and are just going by AAPC. AHIMA is the American Health Information Management Association. If you want to know more about these organizations and the different certifications that they have, you can click this video up here and it will tell you more information about them. I will also link it below. Now, before diving in, it's really important to make sure that this is the right career for you. It can be very rewarding. It has lots of those remote opportunities, so it has lots of flexibility and work-life balance, but it's not for everyone. It's really suited for people who are continuous learners and they like to grow and adapt and who like to problem solve. Medical coding isn't something that you can learn once and then set it and forget it. It's something that you have to earn continuing education units for. So you have to go onto webinars, chapter meetings, read magazine articles, take quizzes, recertify. So there's a lot of continual involvement in learning these new trends and code updates, insurance updates, federal law changes, a lot of information. It also requires a lot of reading, so if you're not someone who likes having to read through lots of medical records and analyze all kinds of information, it might not be for you. So there is a lot of sitting, there's a lot of reading, a lot of computer work. Most medical coders, I would say the overwhelming majority of them, work with at least 2 monitors. One will often have the medical record system open on it. The other will have maybe a billing or input system in it. Or even things like digital coding tools, lookup tools, and coders, we call them. It's also very productivity and accuracy based. So a lot of employers are going to say you have to code a certain amount of charts, and with a certain amount of accuracy, most places it's like 98 or 95% around that area. The productivity changes. I can't give you an honest number because depending on the type of coding you're doing, what kind of records you're retrieving, how fast you're your system is, your specialty, it could vary so much. That's why a lot of employers actually have rules about not watching young children or caretaking for others while you're on the clock on your job. I know medical billing and coding is often promoted as a job you can do from home, and they target moms and they say, hey, you can save on your daycare costs, but honestly, most employers don't want you watching your kids because they want you focused on your work. It can really affect your productivity and accuracy if you're starting, stopping because you're taking care of a young kid and changing the episode of Bluey for them. And you are an hourly position, so you have to bill accurately for the hours that you are performing your job. And landing your first job is going to take some effort. You have to go at your job strategy with as much tenacity as you did when you were studying and trying to get that certification in medical billing and coding. The enthusiasm doesn't end at certification, it has to stay through. And strategy matters. Things like staying updated on industry trends and doing things like subscribing to the channel and hitting the notification bell so that you can get alerts when I post new episodes. Now, of course, you're likely considering salary. Salary for this job is usually around the $50,000 range. It could be higher or lower in certain areas, which is why I recommend to check the AAPC salary calculator. They can give you a better picture of what the standard salary ranges are for your specific area, for certain expertise areas, and for different certifications. And of course, getting certified is going to greatly increase your job prospects, especially if you're going through AAPC or HEMA. You might have a school that recommends a different certification. Sometimes they partner with a certain association and kind of give them a discount on other certifications in billing and coding. But I'm telling you, while those are fine and it's good to demonstrate your proficiency, what employers are looking for is AAPC or a HEMA. So if you're like, yes, this all sounds fantastic, I am ready to go, I love analyzing medical information, that sounds so fascinating, I want to work behind the scenes, I want to work from home, having multiple monitors sounds awesome, well, you're going to have to get some training in medical billing and coding. And there's a lot of different options out there, but the one I recommend is today's sponsor, which is Preppy. If you want to become a medical biller and coder in as little as 6 months without going into student loan debt, sign up for my free career masterclass in the link below. That's where I share all the industry secrets that I've had in over 15 years in this industry. Things like how to get into medical billing and coding the right way, the certifications everyone's looking for, how to save you time, how to save you money, how you might even qualify for a free laptop with your program, and all without going into student loan debt. The masterclass just gives you that full roadmap of how you go from someone with no experience in healthcare to job ready as a billing and coding specialist in as little as 6 months. Definitely check it out, medicalcodingmasterclass.com, and it will tell you all the things you need to know, including the program that I personally endorse, which is Preppy. Seriously, it checks off all of the boxes of everything you need. Just go and register for it. Now, there are other options out there. There are colleges now that have associate's degree in billing and coding or even diploma programs, which is actually what I have. And this is especially great if you have things like employer reimbursement, where they will pay you, or at least pay a good part of your tuition in order to go to school. If you're already working in healthcare, they give oftentimes great incentives to stay with them. If you go to college, they will pay part of your tuition. And typically going through a college is the only way that you will qualify for some sort of grant. Although college tends to be the longer and more expensive process, and overall employers are really looking for that end game, that certification. Now, you can get direct training from the AAPC or AAPC approved instructors or equivalents. You can even find some accelerated programs out there, which are great if you're already in healthcare or you have an understanding of electronic medical records and HIPAA and different insurances. You can probably cut a couple of months off of a program. And there is also self-study. Of course, self-study is not for everyone. You have to have that dedication. You have to stay to a steady study regimen. I have below the books that I recommend for self-study. So of course you're going to need your 3 code books, and you're also going to need the step-by-step medical coding books. Those are the ones I recommend for learning medical coding. If you need MedTerm, there's also a great book called Medical Terminology and Anatomy for Coding. Again, I will link them all below, or you can watch the video that I have up here. I will also link it below on all of my tools that I have for self-study and recommend. Now, once you've chosen your program, you've studied, it's now certification time. So you have to make that decision if you want to go with AAPC or a HEMA. I personally like AAPC. I think they're easier to understand. I think there's a better membership base. I think CEUs are easier to find. But if you're looking specifically to go into inpatient facility coding, you might want to look into AHIMA. Do some practice exams, get some study guides, pay your membership fee for the association you want to get certification from. Membership fees are due every year with AAPC or AHIMA. And then you have to pass your certification exam. Now, membership and exam costs are going to vary, but remember that investing in yourself is part of this journey. But to give you an idea, the AAPC membership fees as of 2024 currently are $205 a year, and the exam fee for the CPC is $499 for 2 attempts. Now, when you've got those shiny new credentials, the next step is you have to update your resume. Make it shine with all your shiny new credentials at the end of your name, at the very top of your resume, all of your pertinent skills and your work history, but be careful because a single mistake on your resume can make or break some of your job opportunities. I've worked in organizations in the past where we've interviewed someone to bring onto our team and they had a spelling error or two on their resume, and my coworkers were like, absolutely not, because if they're going to be this careless with something as important as their resume, what kind of mistakes are they going to make on the job where accuracy really matters and it could cause big financial impacts? I have lots of job hunt videos where I give you some of my great tips, things like searching for ICD-10-CM instead of just medical coder or medical coding, and that way it brings up all of the jobs that have skill sets for ICD-10-CM, which is one of the code sets that we use. And of course, doing things like connecting with your peers in your local chapters for all of those great networking opportunities. With the AAPC, if you do not have 2 years experience or equivalent, which you can get through things like going through 80 contact hours of an approved program, like through Preppy, or going through a Practicode, which is all of these mock modules that you have to hand code. If you don't do those things, you will be designated an apprentice coder, or you can have to get 2 years of experience. So getting that apprenticeship status is a big thing for coders because there's certain recruiters that if they see you're an apprentice coder, they will ignore your resume. Medical coding can be a lot more than just a job. It can be a huge opportunity to get into healthcare and to evolve into amazing roles like auditing and compliance. If you're ready to find out more information, again, definitely check out medicalcodingmasterclass.com. Remember, you want to make sure that this is the right career for you, and then you will get the flexibility that comes with it, the benefits that come with working in healthcare, and all of those amazing growth opportunities. And I am here to help you along the way. There are so many amazing resources for every step of your journey right here on the channel. If you want to find out more information about being a medical coder, you can go and check out this playlist right here. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.